So once the skin cancer has been removed, usually when we have cut it out most of the time, we'll get a report back from the lab that will confirm that it's been removed. For most people, that would usually mean the end of that particular skin cancer. However, there is a small percentage of people that will still be unlucky enough to have some sort of recurrence of a skin cancer. And if that's the case, we need to manage that as soon as we can detect that in future. And that's why that future sort of surveillance or skin checks is really important. We also know that once you've had skin cancers, you're much more likely to have other skin cancers. Usually because, although it's not the only contributing factor, sunlight exposure is a big risk factor in the amount of UV radiation damage that your skin has had. And we know that once it's had enough damage to cause one skin cancer, logically it's going to have enough to cause potentially other skin cancers in future. And again, that's why once we detect a skin cancer in somebody, it's very important to one, have a low threshold for coming in. If you detect anything at home or anything that you're worried about, you get it checked straight away. And two, having regular skin checks to pick up on any early stage things that you might not be able to detect, so we can treat them at an earlier point and much less likelihood of anything nasty happening in future.